All right, let's go ahead and we're going to be doing our Kahoots. It is 100 questions, guys. But when you look at it, don't just look at the questions. Look at what concept it's trying to talk about, okay? That's what you start to need to think about, especially going into capstone next term, right? If you can't take a concept and take it and mix it around 5 times and make it work, you don't know the concept good enough yet. Because there's always, at least, I always say there's 6 different ways of fixing something. What's the best way, right? And then how did you know it fixed? So these are things as you start thinking and going over these Kahoots questions. What's the concept? What do I need to know? How did I know it was there? What do I need to do to fix it? And then, did it fix? Right? That's all your ad pie. What do you see? What do you got to do? And did it work? All right, so 100 questions. I'm just going to keep going until we get there. I'll go to 5 o'clock and then I'll stop. If you want me to continue, I'll continue for the 100 questions. It's up to you at that point, okay? Let's just get going.
Did you say
who's going to win?
We're going to post this HESI like after this? I mean, this Kahoot after this?
I'll post everything. Don't worry.
Okay.
Multi-select. What are the signs and symptoms of pyloric stenosis? This one should be really in the top of your brain right now. So remember, as infants, there's either a little spit up or there's across the room. If it's across the room, take your hand, put it underneath the xiphoid process, and you should feel a little olive. I call it a marble. Same thing, a little round something. That is the thickened pyloric muscle. That is all tensed up and milk can't go down. So if milk don't go down, the baby drinks, is happy, and all of a sudden you're looking at the baby and it's in your face, like across the room, 10 feet, it is projectile. It is impressive. And if you're not drinking and nothing's being absorbed, of course your urine output's going to go down, and then you'll see signs of dehydration also. A multi. Signs of acute respiratory distress in an infant. Remember, respiratory distress, whether they're infants or adults, there's things that are specific to everybody. But then with infants, what else do you see? This is the nasal flaring and that that grunt at the end of a breath. And they tend to bob. Their whole head bobs with it. Respiratory rate of 52. Is that respiratory distress in an infant? Really? What's their normal respiratory rate? 40 to 60. So actually, it would have to be 70 or 80 would be respiratory distress, not 52. I have to uncheck that button. A multi. When caring for a child, they suddenly stiffen and have a seizure. What should the nurse do? Again, this is this week's, isn't it? Remember when you're taking your HESI, always remember safety, always remember infection control. Those will always be a part of an answer somewhere. NCLEX loves those things. So safety, number 1, turn them to the side so they can vomit that way. What was the time that it happened? So we can, was it a minute long? Was it 20 minutes long? Pad the outside and flatten the bed so that we have an airway open. Now, if a seizure progresses, then you would start an IV and maybe give some IV medicine. And of course, maybe call a code at that point. It's that initial, turn them over, clean the stuff out of the bed, making sure you've padded what you can so they don't hurt themselves. And then it gets to the point where, all right, it's not stopping. We're calling help and we're getting some medicine. Let's get that IV in now. A multi. What may be a problem seen in an infant after open heart surgery? So remember, open heart surgery infant means you have congenital heart disease. So you're born with a heart that's already very, very weak. So then you have to give them food, right? Nutrition. Suck, swallow, and breathe is a difficult thing for them. So you'd see an elevated heart rate, elevated respiratory rate. They would tire easy. They wouldn't eat. They're not going to gain weight. And of course, when the heart's failing, you're going to see the fluid build up in the lungs, congestive heart failure. Then you hear the noise and you'll see the other symptoms, tachycardia and tachypnea, right? This is all part of failure in a congenital heart. A young man who has cystic fibrosis wants to have children. How do you respond to that? Can they have kids? Remember, their vas deferens mucus is all clogged, right? That's part of it. As I said, women can, but it's difficult. It's a high risk. Men, because they have the mucus in their vas deferens, the sperm can't get to mommy. For some reason, I don't know why, after they have a bilateral lung transplant for cystic fibrosis, 1 year later, they can get a woman pregnant. I guess the mucus disappears. I don't know, but it's part of what the reading says. I really would like to know how that pathophysiological, how all of a sudden that works. Does the mucus disappear? I'm not sure. An infant with tetralogy of Fallot has a TET spell. What is your priority action? Remember my little boy I've told you about, little Nolan Ryan, who had a TET spell on me at 5 o'clock in the morning? He went from 100 sats to 10. He went from pink to dark blue. And what I did is I took my knees, his knees, and pushed him to his chest, a quick swoop. It's not like, oh, let me just put your knees there. It is put your knees together. It is like sitting quickly as a squat that older children would do. It just changes the pressure and it pops open that pulmonary artery and lets the blood flow to the lungs. Oh, no, they're multis. The nurse should assess the infant with a congenital heart disease for which early sign of heart failure? Heart failure, congenital heart disease. The heart's not built right. It's got to work hard. It's angry. It gets tired quick. It also starts to beat faster because it can't squeeze all the way and it can't get the blood around the way it should. So it tries quicker and it just flaps and it's just not working and it's just getting tireder and tireder. And that's heart failure in a child. Nurses provides instruction to the patients regarding administration of digoxin. When would they need further instructions? Which one of these is not right? Very good. Remember, digoxin and children, especially infants, the only first symptom that you see that they're dig toxic could be vomiting. So if a child vomits, call the doctor. They may want to do a dig level. If they're home or in a hospital, you're not going to feed them. You're going to call the doctor, get the dig level because it could be dig toxicity. Your child's been playing outside in a field with long grass. What would be a priority? What would be your concern about playing outside in long grass? Next to the swamp, in the bushes, in the woods. That's where I grew up in New York. I was always out there somewhere. The thing about long grass outside, swamps, brooks, around lakes, those things is the chance of getting ticks. So, what's your priority? The number one thing is to check visual, head to toe. And if we see them, there's ways that we can get them out, call the doctor, or get them out yourself, because we need to get the ticks out because it causes Lyme disease. I've seen Lyme disease a couple times in my career, not many, but it was extremely difficult to diagnose. And they ended up getting the diagnosis and they gave the treatment for it. But it was a long time to get there. A toddler presents with sudden severe abdominal pain. The diaper has current jelly and bloody stool. What is that telling you? Current jelly, bloody stool. What is that? Tummy hurts, screaming, legs kicking, arms kicking, crying, inconsolable. That's what these children look like. And you can't give them pain medicine, it doesn't work. They're that intensely in pain. It is called intussusception, okay? It's when the intestines suck into each other like a telescope, and then it swells. And because there's all nerves in the intestines, it hurts really bad. Sometimes, and these are toddlers at ages 1 to 2, those are 1 to 3. These are the ages we see this a lot. All of a sudden, though, they're running around the room. What happened? Well, it popped out. And sometimes they in and out. They go screaming, yelling. It pops out. They're running around. They're happy. Puts back in. They're screaming and yelling. Get them to the ultrasound. If we can see it, then we know what it is. If not, we're going to say increase the fiber in your diet. If it happens again, come back. And usually, just increasing the fiber usually helps that. I've only seen one surgery have to be done with that one. A 6-month-old infant's been placed on thyroid hormones for congenital hypothyroidism. What shows you it's been effective? So you have a thyroid problem, you're giving hypothyroid medicine, levothyroxine, same time in the morning every day, right? Not at night, it's going to keep you awake. Congenital hypothyroidism would be a meconium stool, right? There would be no stool at birth. That would be one of the suggestions. One of the things with thyroid is that their cognitive and their height and weight will be effective without it. So if they're 6 months old and can roll completely over, they are absolutely on target. That's where they should be developmentally, okay? They should be able to lift their head by 3 months. Reflex palmar, about the same. Constipation would be, it's not working. What's one of the side effects of things that happen with hypothyroidism? Constipation. So you would reverse that. You would increase fiber in that one diet too, if you could. An infant should be able to sit unsupported at what age? And it's 8 months. This is a question that you will see asked in many different ways. You have a child who's 10 months who cannot sit up. Is that appropriate or not? Or you have a child at this age is doing this. Is that appropriate? So go over your infant developmental stages, fine, gross motors. There'll be questions looking like that. And this is one of them. They love sitting unsupported. A multi. What assessment would a nurse see with a child who is dehydrated? Signs and symptoms of dehydration. So dehydration, elevated heart rate, decreased blood pressure, decreased urine output, prolonged urinary output decreased, prolonged capillary refill, skin tenting, and then the one thing with infants, when they cry and there's no tears, I think that's the saddest thing to see a baby crying with no tears. That is what you would see. Peristalsis has nothing to do with dehydration. Growth hormones are started on a child. What assessment will show the medication has been effective? So you have a kid who's short, but the family's tall, so we can give growth hormones to this child. Remember, it's sub-Q, it's every day. So it's a big commitment. So you need to monitor it. I'm giving this every day. Is it working? Well, you're going to see a growth. Now, they stop giving growth hormones when they stop growing less than 1 inch a year. Usually, right about that pre-adolescent growth time is when they stop it, but they try to catch these kids up so they're not so short. Excuse me. One of the symptoms of rheumatic fever is chorea. What would you tell the parent about these movements? Rheumatic fever. What causes rheumatic fever? A strep infection. What do you see with rheumatic fever? One of the things is that central nervous system chorea, right? The big one is mitral valve, which is something that cannot be corrected with giving medicine. Chorea. Once we treat the rheumatic fever with an antibiotic to treat the strep, chorea will disappear. The only thing that you're left with is heart valve damage or mitral valve. A mother of a 2-month-old is worried because the back of her child's head is flat. What should she tell the mother? So when you have a parent, because we have everything back to sleep now, we're worried about SIDS death. Babies should be placed on their backs, supine, to go to sleep or take naps. So when they are awake, wide awake, and they can hold themselves a little bit, they should be placed on tummy time. And that helps smooth the back of the head. Remember, their heads are very soft. They're not going to get flat. Give them that time off of it. It helps. What statement from a parent would be concerning regarding a child diagnosed with croup? Remember, croup is oral pharyngeal. It's swelling. Air can't get in, so it's inspiratory stridor. Usually, what do we do with croup? Well, we'll give a steroid to stop the swelling and allow air to go in. If it gets to the point now where you can't swallow, what's that a symptom of? Epiglottitis. Croup can turn into epiglottitis. That is a big red flag. That child needs to get to the ER right now. A child has myopia. What would be appropriate for a nurse to tell the teacher? You know, amblyopia, nystagmus, strabismus. So this one might be that farsighted or nearsighted. That's how you got to remember these things. So what are we going to do? Well, it's probably I can't see, right? Myopia, I can't see far. Put them in the front of the room. They'll be able to see the board and do better at school. That patch is for amblyopia. Multi. A child's born with a myelomeningocele with sensory and motor deficits. You must be careful with what? Remember, myelomeningocele is the back of the meninges are born outside of the body on the low spine. Remember, just because this happened doesn't mean that their minds aren't perfectly fine. I had my little Manuel, who was a perfect child. I saw him after a newborn. I saw him again when he was 13. He had just gone to his 8th grade prom. He was in a wheelchair, yes. He had a myelomeningocele, but he was alert, oriented, and a smart child. Our big concerns is with these children is that many of them don't feel that they need to urinate or defecate. Many of them require frequent bladder catheterizations. With that, these children from the get-go when they're born, latex allergy because of the sensitivity and the amount of gloves we'll be using for the care of them. So we got to be careful with the bladder catheterizations because of latex, right? Big deal there. What interventions are needed for an immunosuppressed child that has a platelet count of 10,000? Well, I don't care who the person is, child, adult, they have a platelet count of 10,000. What does that tell you? What nursing care do you need to do? What do platelets do? That's how you read that question. Platelets have to do with bleeding. Remember idiopathic thrombocytopenia purpura? ITP, platelets. It's all about bleeding. Same things. It doesn't matter if it's due to an ITP, that viral infection, or due to just being overwhelming, sick and septic. You can have platelets that low. Doesn't matter to the patient. 10,000 platelet count, lower than 100,000 actually. Bleeding precautions. They will bleed. Look for petechiae, ecchymosis, bleeding in the urine, from the gums, from the stool, from wherever. An infant was seen in an emergency room for a febrile seizure, and the mother asks if her baby has epilepsy. What would you tell her? This happened to me with my firstborn grandson. He was 18 months old and he had his first and only febrile seizure. Remember, febrile seizure is a fever that's gone from no fever to a fever quickly, 20, 30 minutes. It is the rate of rise. That change of temperature the brain don't like, and it synapses and it sparks a fever. Do they have epilepsy? No. Usually febrile seizures by the age of 6-ish, they do disappear. How do you diagnose if they have epilepsy? It's more than one seizure a day, unprovoked, no fever. Okay. An 18-year-old parent wants the child's lab results. Are you going to give it to them? You'll always see HIPAA questions. HIPAA, safety, infection control, they're always going to be there. Safety, they're always there. You have to get permission from the 18-year-old. It's not against hospital policy. It's just against, this is an adult. At 18, they are legal. You cannot, it's the court. It's not just hospital, it's beyond that. If they want it, you have to ask the child. In fact, working in a pediatric emergency room that I did for the last 10 years of my career, you'd get an 18-year-old child in there. I would, or the doctor would have to say, do you mind if your parents stay here and listen? Can I discuss the lab results in front of your parents? Very, very important. What is palvizumab Synagist used for? Palvizumab is the RSV. Make sure you look over those things. What closes a PDA? Indomethacin. What keeps it open? Prostaglandins. So those three things, you absolutely don't mix them up. What medicine can be used to treat an infant that's in the acute phase of RSV? Now, we didn't really talk about what medicine to use. RSV is a fever, right? It's that little common cold of infants. And the big deal is the amount of mucus. They can't suck, swallow, and breathe. When they get older, it doesn't matter. They can blow their nose. But there is a treatment, especially the ones that are pretty bad. And it is Virazole, OLE. That is a viral medicine. That's how you pick that one. Ribavirin, you wouldn't know, but that OLE That's telling you it is a viral. Very good. What is the highest priority for a preoperative infant with bladder exstrophy? What's bladder exstrophy? The bladder was born on the outside of the body. It still works, still connected. You still urinate in a diaper, but your bladder's sitting out there exposed to the world. So what are you going to do? Highest priority. You're going to make sure you keep it free from infection. How do you do that? You're going to put a sterile, wet, normal saline dressing on there, and you're going to keep the skin integrity as good as you can so that they can close it up. Big thing is don't let it get infected. You don't want to put an infected bladder inside the peritoneal cavity and close it. That's not good. A smart 8-year-old wants to have an insulin pump for type 1 diabetes. Well, diabetes is a lot of blood glucose monitoring. It's a lot of giving insulin 3, 4, 5, 6 times a day, depending. Having a pump is a great choice because you stick one needle in and you bolus it from the pump. It's only one stick once a week, once every 10 days, depending on what is the routine for changing the tubing on and needle on your pump. But it's just one. Now, it is great for children that are intelligent enough to be able to monitor it. They've got to be able to monitor it, troubleshoot it, and understand blood sugars. But yes, great option. It's a lot less insulin syringe needle sticks, right? Another multi. Why would a Lyme test be done on a child? I told you that before. Do you see how his head is buried in underneath the skin there? And they bury underneath, and you have to try to get them out, their whole bodies. And it's all about the tick. We want the tick out and we want to get rid of it. And they do the testing for Lyme disease 1 to 2 weeks after they've been exposed, or maybe that the tick was there and they got it out, but they're just doing to be sure, or they're trying to figure out maybe they got stuck and we didn't see it. Multi. What assessment would you see after administering an IV bolus of albumin to a child? Well, what does albumin do? We call these volume expanders. It puts the protein back in the blood. It pulls out tissue, fluid from the tissue, puts it back inside the blood system. So it sucks it out. So when it sucks it out, it makes the urine output go. And also, if the urine output's going out, they're going to be breathing easier, calmer, and you're going to see the heart rate come down with it. It's pretty cool to watch. When you have a child dehydrated, give them a bolus of normal saline. What's the one thing that you know and you could watch if you're on a monitor? The heart rate starts to slow down as the bolus goes in. You know that they're catching up on volume. It's pretty neat to watch. A male infant is born with an epispadis and they cannot circumcise the child. Why can't they? Epispadias, what is it? Male with a foreskin, penis, and the urethra comes out on the bottom or on the top. Epispadis is up top. Hypospadias is on the bottom somewhere. And what they have to do is before they get to be potty trained, they must do a surgical, and it's an intense and surgical repair. They fillet the penis open. They create a cavern to go from, the bladder to the end of the penis, and then they put a catheter in there. And then they take the foreskin as a plastic closure to close the penis back up. They leave that catheter in 7 to 10 days. What is our nursing care of that? Put that catheter inside a diaper so you don't urinate everywhere. That's it. Leave it alone. Don't touch it. It's not your responsibility. Just make sure you keep it in there. A child is wheeled into the ER, leaning forward, drooling, no cough, severe stridor. What do you suspect? Drooling. What is that one? That is epiglottitis. Very good. Another multi. To diagnose Duchenne muscular dystrophy in children, an EMG may be done. What teaching do you need to tell the child and parents? Duchenne muscular dystrophy is muscles that progressively get weaker, all your muscles of the body. And the way to diagnose this is to take that little machine and insert electrical shocks, and it spasms the muscle. So they measure how long did it take to put the shock in till it moved and how much did it move. Well, when they're done doing this around the body, this child has felt like it's gone through a marathon. Okay. So when they come back, they're going to end up with that day after, like you went to the gym for the first time in 3 years. That's what they're going to feel like. They're going to be sore, and they're going to give them either acetaminophen, ibuprofen, whatever they can have for discomfort. And let the parents know it's just temporary. That was the test, but the child will feel better. A multi. What conditions would you suspect on a newborn Down syndrome child? Downs. We know leukemia, right? Leukemia, hypothyroidism, congenital heart disease. Do they have dysphagia? Not really. They can eat fine. They got a tongue, but they can eat. Bowels have nothing to do with Down syndrome. Remember the big three. Hypothyroidism, congenital heart, and leukemia are the big three on Downs. A child admitted for persistent vomiting and diarrhea. What assessment's most important? So when you have a child vomiting and diarrhea, what are you most concerned about? Their fluid volume, right? Because dehydration is dangerous with children. So what's the first thing? Listen to a heart rate. And if we get an elevated heart rate, we know they're quite dehydrated. If it's normal, we can move a little slower, right? But typical heart rate is 140. The child's 1 year old. We're going to start fluids as soon as we can or get something into them as soon as we can. What information would the parents and child need to understand about impetigo infecciosa? On the HESI, there's sometimes some of these normal childhood illnesses in it. This is one of them. Impetigo is a scab that oozy, juicy, and it just spreads. It's a huge staph infection. The thing about impetigo is it's extremely contagious. My grandson had it on the back of his calf, and mom said he had itched a mosquito bite too much and it was big. And I went, I don't think so. The next day, because he had stayed with me, it was bigger. I said, it's impetigo. So I put Mupricin cream on it. It got a little better, but I know they need oral and topical type of treatment for it, and then it goes away. Now, the thing is, when it's done, there can be little, like, slightly reddened scars back there. So tell the parent you might see some scarring afterwards. Also, depending on the color of the skin, there could be more scars on some children than others. Another multi. What is another word that is used to describe erythema infectiosum? There's a great picture of it. Viral infection of kids. They come in and they're sick. They got a fever. They might have a cough, but they got these big, big red cheeks. And the thing about these red cheeks, it looks like they've slapped their face. So it's called either erythema infectiosum. Sometimes there's rashes all over. Sometimes it's just a red face, but it's called fifth disease also. What's the treatment? It's viral. Antipyretics, fluids, and rest. What is the treatment for pertussis? Well, we do have an immunization for it, but it's come back. So, pertussis is another airborne, needs to be under, reverse isolation, airborne isolation for, us and for other children. The treatment is actually just azithromax. It's an antibiotic for pertussis. Multi. What are some side effects to watch for in a child who is taking antibiotics? Any person starting antibiotics, especially children who probably have never had it before. What's always your concerns? So you have a child on antibiotics. You always worry about that vomiting, diarrhea, abdominal pain. In fact, many children, if they become sensitive, they might give them probiotics just to start with, or they would tell them, maybe another antibiotic. There'll be some that they can take better than other. But these are common symptoms of first time taking antibiotics. How do you get rid of cradle cap on the infant? No cradle cap. Do something to moisten it because it's dry, right? Moisten it up, and then you take a fine tooth comb and gently comb it when you're done with the bath. There's some literature that says put on mineral oil at night and then in the morning comb it out. But the whole point is moisten it, they can bathe it, and a fine tooth comb can get it out. It's not going to be one time, it's going to take several, but it's okay. Another multi. Post-operative abdominal surgery child has an elevated heart and respiratory rate. What assessments might you make? Why are they having an elevated heart and respiratory rate? They just had surgery. What's going on? So, things that can elevate a heart rate are fever, dehydration, and pain. In this case, I'm sure it's the pain, but you've got to rule it all out to be sure that's what it is. A mother whose child is undergoing chemotherapy asked the nurse about giving her child receiving immunizations. What do you tell a mother? Child's under chemotherapy. Can she have immunizations? So the whole thing is to delay the vaccines for at least 6 months after. With immunizations, remember, immunosuppressed children don't get live vaccines. That also is with a child on steroids. You're rendered immunosuppressed on steroids, okay? What can cause rheumatic fever? Strep throat. Very good. What's the treatment? Give antibiotics, take care of it. Rheumatic fever. What will not be cured or turned around? Mitral valve. You'll always have that mitral valve condition, whether medical or surgical treatment. An adolescent girl wants information regarding birth control. What does the nurse do? Give it to her? What? So when you have an adolescent as a nurse, or even school nurses, if some of you are going to go there, you may give her written and oral information, not your opinion, but you can give written and oral information. You don't need permission. Another multi. Child with hemophilia fell down hard on her knee. What are you going to do? Fell on her knee, it's hurting, it's turning purple, swelling. Ouch. What do you do? She has hemophilia. What's your concern? So when we talk about hemophilia, it's just like an orthopedic injury. It's rest it, ice it, contain it, ace bandage, and elevate it because you're going to decrease the swelling. You're going to put cool ice on it. You put heat on it, you dilate it, you increase the bleeding. You're going to give that missing factor. If it's bleeding like that, yes, the parents at home or caregiver know how to give it. And a child who's already hemophiliac, which means they're already bleeders, no NSAIDs, no aspirin, because that causes bleeding, prolonged counts on those too. So you don't want to give it. A multi. How can you decrease gastroesophageal reflux disease in an infant? So with reflux in infants, the first thing you do is always conservative, which means you want to make sure that you burp them, that they're not overfed, that they're sitting up after they eat. If that doesn't work, they're burped well, etc., then you would add a little bit of rice cereal to the formula. Why would you put a baby on their tummies right after you eat? So no, it's not placing them prone in the crib. It's sitting them up afterwards and giving them that rice cereal. A multi. What is priority information? What priority information is needed during the initial assessment of an infant with a 101 fever and a cough? So you need to assess a child and they've got a fever and a cough. What do you need to know? What's most important? You have an infant. So you don't really have to know birth history unless they were admitted to the newborn ICU for a period of time. What you need to know is number one, you need to take care of you and you need to take care of the other children in your care. So, what is the immunization status? Making sure, have they had their immunizations, or this could be pertussis or one of those. So, very important. Also, what medications? What time do they have their Tylenol? If they're over 6 months old, have they been given the ibuprofen? What have they had when? And of course, allergies is always part of it. Another multi, got a lot of them. What precautions should be taken for infants born with a myelomeningocele? So remember, that's the meninges and the spinal cord on the lumbar spine. It's born on the outside. It pulls that nerves up and out, is what it does. So lower extremities are going to be weakened. Sometimes they don't even feel them at all. Our concerns at that point is watching urine and watching bowels. That's too big. Those nerves are dead. They don't know if they can feel it. And then, of course, latex precautions. Every child, myelomeningocele, because the amount of catheterizations and surgeries, etc., we don't want them exposed to it all. Myelomeningocele has nothing to do with airway. It's lower extremity. It's from the belly button down it worries about. A multi. A 17-month-old eats with a spoon upside down. And the mother asks, is that normal? A toddler takes a spoon, it's upside down, backwards, sideways. Is it normal? So Why is the mother concerned? It's big. Maybe they have another child or the sister is a child with issues. You don't know. It is absolutely normal. This is experimentation. This is what toddlers do. So it's normal. I mean, they're trying to eat. That's what you want. So it's good. But again, why is mom concerned? A multi. How is juvenile idiopathic arthritis treated? JIA. Juvenile idiopathic arthritis or juvenile rheumatoid arthritis. It's the same thing, different name. They changed it. This is something I suffer with on a daily basis. So I know this diagnosis quite well. So, how do we treat it? Well, pain control by NSAIDs is the most effective. They start you out on methotrexate, whether orally or injections, and it does help calm the immune system down from what? Attacking the joints. And it's swollen, painful, they hurt. And then we give steroids in the flares when it's so swollen, you're so miserable that it does decrease the swelling and helps with the pain. Synagist is for RSV. A toddler vomited 2 times, but listless and irritable. What would you tell the mother on the phone? So the mother's calling you from home, and their little child vomited, but they're listless and irritable. What is that telling you about a child? And then I'll let you know, does it matter the amount of times that they vomited? I've seen one big vomit be a child who was severely dehydrated. So 2 vomits, listless and irritable, it is possibility. This child is severely dehydrated. Get them to help right now. They need to get orally. And they're vomiting, so you can't tell them to give fluids. Stop drinking, nothing by mouth, get them to the ER right now. An adolescent status post amputation for osteosarcoma is angry and blaming the parents. Why is he doing that? What did the parents do? Osteosarcoma, which is usually a femur bone, and you got to remove the leg basically. It is very scary for adolescents, and a lot of them are males. So it's a very difficult time. So this is grief. What does grief do? You blame everybody else first, and then you start to learn, and you cope with it. So it's normal, absolutely normal. Parents do everything wrong. Don't we know that? How do you assess children's outcome that are treated for hypo or hyperpituitarism? So they're on growth hormones, right? Hyperpituitarism must be some sort of growth hormones here. How do we know it's working? In almost every treatment, when you look at kids, when you look at is it working, height and weight, which is one constant every visit, usually can tell us is it working. Another multi. To diagnose congenital heart disease, the child must undergo a cardiac catheterization. What are the risks of a cardiac cath? Remember, a child who comes in, suspected congenital heart disease, they do an echo, the echocardiogram. They find something, the kid's going to go for a cardiac cath. Remember, they put two big, and look at the size of that catheter there. Two big catheters in the vein and the artery, femoral artery and vein. And when they take them out, big concern for bleeding. That's always my first thing to look at. Also, they've occluded those arteries. You've got to be careful. What are the pulses going down to those toes now? Dorsalis pedis, posterior tibial. Are they there? And to document, they're going to be slightly decreased. So document it for the next nurse that comes on. You shouldn't have a fever post-procedure. Is it going to be uncomfortable at the entry site? They usually put long-lasting lidocaine there. It could be tender the next day, but usually not right after. Multi. Infant born with a TE fistula. What should the nurse have at bedside? A tracheal esophageal fistula, a connection between the esophagus and the trachea. What's your big thing about that? Remember, those are the two ones. TE fistula, pyloric stenosis. What are the differences? Do you know how to treat them? So, TE fistula is not going to be fed. Why? Because it goes down the esophagus, goes across that fistula right into the lungs. We don't feed them. They're going to have suction at the bedside because you still swallow mucus. You're still spitting and choking on that. And always head of the bed elevated. Yes, that's all you basically do. And you wait for surgery. How would you promote normal growth and development of an infant with esophageal atresia? So, what is esophageal atresia? It's esophagus with no stomach. So, this child is not going to eat. So, how are you going to promote normal growth development when this kid can't eat? That's what the question's asking you here. And you think it's like such a small little thing, but how do children in the world explore it? How do they soothe themselves? A non-nutritive sucking device, a pacifier. Multi. A child's been having diarrhea for 3 days. What should the nurse assess? Again, diarrhea, 3 days. What's that all about? What should I be concerned about? What do you need to assess? As in, what's priority here? How are you going to know what to do? And you're going to look at heart rate, blood pressure, urinary output, skin tenting, capillary refill. Am I awake and alert still, or am I getting drowsy and listless? Very good. Temperature doesn't make a difference there. A multi. What assessment findings would you see in a child with cystic fibrosis? Remember, cystic fibrosis is 3 different things. It has to do with the lungs, has to do with nutrition, and the loss of electrolytes. When you lose nutrition, you're going to have growth delays. Because of the nutrition and the lack of fat digestion, you're going to have that steatorrhea, that foul, I'm sorry, soul, but it's foul smelling stools. And also, it's full in the lungs, so you're going to have lungs full up. Obesity? No. In fact, these are going to be skinny kids because they're losing all of their fat calories. They need high protein, high carbohydrates, and low fat diet, and give them a salt shaker. Another multi. What assessment would alert the nurse that an infant is in an acute respiratory distress? So sleeping a lot, no, because they would be irritable and they wouldn't be able to sleep. So yeah, nasal flaring, grunting, tachypnea, retractions. Yes, yes, yes. What symptoms usually bring a child to the doctor and ends up with a diagnosis of acute lymphocytic leukemia? This was the absolute thing that happened to my next door neighbor several years ago, where she went to the ER one weekend and she went in there with the symptoms of her knee hurt, she had bruising, she had a fever, and she had no energy at all. And it was exactly that. So remember, with leukemia, your white cells aren't there, so you're apt for infection. Your red blood cells are also low, so you are tired. Your platelets are also eaten up, so you have bleeding. That's why all 3 of these things you see, okay? A multi. When teaching a child about sickle cell disease, a nurse would include teaching sickle cell. What causes sickle cell crisis? Dehydration, small blood vessels. So, what do we need to do? That's the answer. Remember, they are immunosuppressed. So, if they have a fever of anything, 100.5 higher, call the doctor. You don't want them to get to the point where they have a big fever because they are already immunosuppressed. If they're in pain and they tend to get these blockages and it hurts, they give them Tylenol 2s or Tylenol 3s, these little codeine pills. And when they have pain, they say, take it, don't wait. Because by the time they get to the emergency room, we'll give them IV morphine or IV hydromorphone, whatever they need. But if they don't start, it doesn't work as well. Again, keep them hydrated, keep them warm. If they're going in an airplane, extra fluids. If they're going into the cold, make sure they wear warm clothing. All of those things. Keep blood vessels big, dilated, and plump. That's the answer for sickle cell. A newborn is diagnosed with a TGA. What's priority treatment? Transposition of the great arteries. The aorta and the pulmonary artery are switched. So the problem with this is you have oxygen blood and systemic blood, and they're not mixing. Fetal circulation is going away like crazy quickly. So we are going to put them on that prostaglandins because what is it? It's an oxygen giver. When they're switched and there's no oxygen, you need what the heart gives you, the oxygen giver, which is your patent ductus arteriosus, fetal circulation. How do you keep that open after mommy's gone? We start a prostaglandins trip. Very good, guys. A child with sickle cell disease goes to the ER with severe pain in her left knee. Priority treatment to decrease pain. Sickle cell disease. Are you going to treat a symptom or are you going to treat the cause? That's how I'm looking at that answer. You can treat the symptoms. The symptoms are pain. Sure, give it to it. Put heat on it. That's a symptom. It will dilate it. But how do you treat what happened? You want to dilate the blood vessel. Fluid bolus. Okay, you're 5 o'clock. Do you want me to keep going or do you want me to stop? You tell me.
I would like to go home.
Anybody else?
We have been here since like
Want to go home?
7 a.m.
That's fine. That's fine. I'll send this to you like this. It's up to you. Now, I do have other recordings that have the rest of it on my channel. These are the concepts you are going to see. So very important.